Hasan. I am a maternal fetal medicine subspecialist. Fixed and be adaptable is a huge component of how to be a doctor nowadays. That OBGYN doctors actually can do surgeries and take care of patients throughout their lives, and in a lot of different ways, and not just operating. And so I fell in love with this field. Like high school, college, medical school. I mean, there might be a few people here and there, but the majority are not going to.
Good evening, everyone. My name is Noreen. I'm the host for our series Career Talks, and during the Career Talks, we invite special guest speakers to talk about their profession, allowing you all to learn insights about successful careers and furthermore explore paths that will complement your future goals. Without a further ado, please welcome Dr. Hasan. If you want to tell us a little about yourself.
Yeah, thank you very much for inviting me. I'm really glad to be able to speak to you guys. You introduced me appropriately. My name is Abida Hasan. I am a maternal fetal medicine subspecialist. That means that I take care of high-risk pregnancies. But Nayan, please feel free to call me Abida. I think, we know each other socially, so that's appropriate. So yeah, like I said, I take care of high-risk pregnancies. Basically, that means that if a mom has a medical problem, or if a mom may be healthy, but the baby has a medical problem, then I can help take care of those pregnancies.
So I thought it would be really cool if you can share a story that you've experienced as an OBGYN.
Sure, yeah. So like I said, with the high-risk pregnancy aspect of things, I have the privilege of taking care of patients who have high-risk problems. And so a patient that I took care of, and it's actually not uncommon that, you'll see women, when they're ready to have their baby, what happens, right? On TV, a person's water bag breaks and it's really dramatic, and 5 minutes later they have a baby. But that's not actually how it works in real life. And sometimes people can break their water bag before they're actually supposed to have a baby. And so that can be a complication of pregnancy. So I took care of a patient a few months ago who had twins, and the type of twins that she had was the kind where they were not identical and they didn't share a water bag. So baby A, the first twin, the water bag broke, and baby B was fine. But this patient and I formed a relationship of trust and kind of mutual understanding. And I took care of her for about a week in the hospital, because we have to take care of those patients within the hospital, and they don't get to go home if their water bag breaks too early. And the weekend rolled around and I was going to be going off service and not taking care of her anymore. So I, started explaining to her the next doctor who would be coming on, and telling her, the next doctor who's coming on is fantastic. You're going to love her. And she said the words that I joke that if you say this, then it's not always a good thing for your pregnancy, because it means that I'll be delivering you soon. She said, "Dr. Hasan, I want you to deliver me. I want you to be the doctor that, does my surgery," because she would have to have a C-section for her delivery. And lo and behold, that same night, she went into labor, and I did her C-section to take care of her babies. And it was really kind of an honor to take care of her, because, I'm going to tell you something that's the bad side of my job too, right? Is that baby B, the one whose water bag was not broken, did well and survived and went to the neonatal ICU, where they take care of very early babies. But baby A, whose water bag was broken, actually didn't survive. And so with this patient, she and I actually grieved together and cried about it together. And at the same time, understanding that there's sometimes we can't, even though we can try everything, we're still human, and we, still, babies can die, bad things happen to pregnancies. But ultimately, in the end, she was just really glad that I was there, because I knew her and I took care of her, and she didn't have a stranger doing her C-section. So it's kind of a story that I wanted to share, because it displays the good, the bad, and the personal. because that's a patient whose story is going to stay with me, for the rest of my life.
Yeah. Yeah, thank you for sharing that. So, moving on, can we talk about your earlier years? Like, for example, when you were our age in high school, what did you want to be? And from there, like, how did you know you wanted to be who you are today?
Sure. Well, that's a great question. When I was in high school, I thought that I wanted to be a doctor, but I wasn't sure. There were definitely times when I thought maybe I'll go and be a teacher, or maybe I'll be a lawyer. Um, but I was very fortunate to get into a medical program that accepts medical students who are in high school to college and medical school at the same time. So it's a joint medical program. And so my future was kind of set for me that way. But I had a lot of different thoughts about, even along the way, about, getting a degree in law so that I could be a lawyer and a doctor, and help the medical profession in that way as well. Um, I'm sorry, the second part of your question, you were asking kind of when I planned or thought about becoming an OB-GYN. So that wasn't actually until medical school. So I kind of always, once I was in medical school, I thought I would be a surgeon, because I knew that I wanted to work with my hands and to be able to operate on people and take care of them physically. But then during my second year of medical school, I learned that OBGYN doctors actually can do surgeries and take care of patients throughout their lives, and in a lot of different ways, and not just operating. And so I fell in love with this field.
So, I know you mentioned about like your schooling and your program. Can you kind of
Mhm.
like go into the process of your schooling and the programs that you went to?
Yeah. Absolutely. So I don't know if you guys have Googled this at all, or if you guys have been interested in this at all, but there are joint medical programs out there. And it's not just medical, there are other fields that have this as well, where when you're applying to college, you actually apply to the professional school at the same time. And as long as you keep up your grades and, get the required minimum MCAT scores and things like that, you get to go straight from college into medical school, or college into whatever school, so that you don't have to apply it all over again for the professional school. And so it's a lot of work up front in high school, but then it's kind of worth it in the end. So for me, I was in a medical program that started out at Penn State in Pennsylvania. And then after 2 years at Penn State, I went to Jefferson Medical College, which is in Philadelphia. And that was for 4 years. So 4 years is kind of the standard for medical school. I'm sure you guys know this, but the standard for an undergraduate college degree is about 4 years. But this medical program actually shortened it so that it was 2 years of college and 4 years of medical school.
Yeah, okay. So, what's the difference? Like, okay, so I know you mentioned that you went to a program, but I wanted to ask you like what we would say to the people who have medicine in mind, but can also see themselves in other professions and they aren't sure about going to med school because like of how time consuming it is.
Yeah, absolutely. So the medical program is one way to go about it, but the traditional route is actually to go through college, get a degree in, very commonly people get a degree in science, or math, or something like that. Um, but now even more medical schools want people to be even more diverse. So you can major in whatever is an interest to you, and then kind of go through the process of applying to medical school. So applying to medical school, you have to take the MCAT, which is an exam that's basically like the entrance exam for medical school. For example, law school has an entrance exam as well. It's called the LSAT. Okay, and so all of these different exams basically give you a score, and that's how you apply to the professional school, is to kind of get a score that gives you a category of school that would be appropriate for you to apply to. Now, I think the one thing that I should mention is that increasingly, professional schools are actually looking for people who have a variety of backgrounds. So they don't just want biology majors anymore. They want people who have interesting things like uh, a degree in history or the arts or something like that, to show that people have some experience in life, not just one line focus towards biology. So that's definitely something to keep in mind, that you want to be true to yourself and explore other things, and make sure that you're making the most of an undergraduate experience.
Yeah. Okay. So moving on to your job today, what's your specialty that you work in, and also what else do you do in your job?
Yeah, thank you for asking that. It's my favorite thing. I actually am very, very fortunate to love my job. So my daily life is very interesting. I do a lot of things at once. I On some days I'll read ultrasounds, and so I work with ultrasonographers who will do an ultrasound on a mom while she's pregnant, and we look at the baby inside. But then I have to look at the pictures and say, this looks normal, this does not look normal. And we do that throughout the whole pregnancy. So sometimes I'll be in ultrasound. Other times I'll be in clinic where I'm seeing patients who are coming in for their pregnancy visits, and making sure that their pregnancy benchmarks are going along appropriately. Like, have we done all the blood tests that we need to do to check on your pregnancy? Things like that. And then other days I'll be in the hospital taking care of patients that were actually trying to keep pregnant. So I mentioned the story about my patient who we were trying to keep pregnant because she broke her water bag too early. So I'll spend days in the hospital where we're taking care of the patients who are there and staying at the hospital. And then there are times when I'm taking care of patients who are delivering. And so I get to do C-sections and vaginal deliveries. So my variety in the things that I get to do on a daily basis is really quite wide. Now, general OBGYN doctors, like I said, I'm a subspecialist in high-risk pregnancy care. So I don't take care of people who are not pregnant, but a general OBGYN doctor also takes care of people who are not pregnant, who have gynecologic problems, right? So if you need your yearly pap smear, you're going to your OBGYN doctor. If you're 40 years old and over and you need to get a mammogram, you're going to your OBGYN doctor usually to get the order to go get your mammogram. And so there's a huge variety in things that general OBGYN doctors do as well.
Yeah. So I know you kind of touched on what you do like today and stuff about your job, but I wanted to know how your off days are like and your vacation days and what you do during those days.
That's a very lovely question. So when I have off time, I really enjoy traveling. Part of that has to do with my global health work also that I do. So I work in Africa part of the time, but I enjoy traveling to other parts of the world as well. I enjoy spending time with my family who lives in Chicago. I actually live in Houston, and so I miss them. And when I have weekends off, I try to go up there and visit them. When I have time for myself to do kind of nothing, I like to paint. So the painting behind me, I actually painted that about 1.5 years ago. And so there's a lot of not a lot of time to do things that you want to on your own, but when you make the most of the time that you have to yourself, you can be really quite productive.
Yeah, that's a beautiful drawing painting, by the way.
Thank you.
Okay, so also, what kind of other professions do you work with?
Sure, yeah, because that's a great question, because I know that there's a lot of people in the audience who may not necessarily be interested in being doctors. So I do actually work with, let's talk about in the outpatient clinics, I work with ultrasonographers who are ultrasound technicians. They are trained to do ultrasounds of women who are pregnant, but also a lot of them have experience in doing ultrasounds for people who don't have a pregnancy, where maybe we need to do an ultrasound of a person's gallbladder or their kidneys. So ultrasonographers make up a huge proportion of the women, of the people that I work with. I also work with nurses and nurse practitioners and medical assistants, kind of a variety of levels of care in our clinics, and everybody is involved in order to make things work. On the hospital side, it's similar. We take care of patients with the help of nurse practitioners and nurses. And, there's all levels of training as well. And so we have medical students, residents, fellows, all kinds of levels of people who take care of patients as well. And then there are other specialties that are not even related necessarily to, like, you don't have to be a doctor, but for example, a pharmacist. The pharmacist that works with my team is one of the most important people that we work with. So there's a huge variety that you may not even realize when you think about all the people who work in a hospital.
Yeah. Okay, so we have a question that came in. Someone asked, what kind of struggles did you have throughout high school, and how did you decide whether you wanted to go into medical field or your law?
That's a great question. So troubles throughout high school is that, high schools are competitive, and applying to medical programs is very competitive. I think you guys know that, right? So trying to keep up grades and at the same time express my interest already in medicine, once I knew that that was the path that I wanted to take, that was a challenge, right? So I was very fortunate that in Pennsylvania, we had what's called governor's school, where it's kind of a 6-week program over the summertime. For me, I went between 11th and 12th grades, and it helps to expose you to different aspects of medicine so that you can learn what it's like. Now, I think the other things that I did to really kind of solidify that I wanted to go into medicine was that I shadowed some doctors. So, for example, working in a doctor's office, just kind of contacting the local doctor in your town can be really helpful, because if you just observe people and ask to participate in a clinic, or even just volunteer. I mean, I'm not even kidding, like volunteer at a hospital, just pushing patients around, from maybe a person's being discharged from the hospital. So you get to push them down from their room to their car in the hospital. That provides some exposure to what kind of things you'll learn and see in a hospital environment. And those are things that I did during my high school years to get my volunteering hours, as well as to expose myself to the medical profession so that I would know that that's what I wanted to do.
Yeah. Yeah. Okay. So I wanted to ask you, like, as a woman, I wanted to know what kind of challenges you faced being a woman in the science field, of course.
Yeah. Well, it's very interesting. We're talking more and more about biases in general, right? So we know that there are subconscious biases that people have, and conscious biases. And so, I think sometimes it's interesting that people will think that men are smarter and women are not quite as smart. And this comes out in a lot of different ways. So, for example, last week I was taking care of a patient who was on the phone when I entered the room, and said to the person on the phone, yes, my nurse just walked into the room. Can I call you later? And I'm not offended by someone calling me a nurse, but it also doesn't acknowledge the title that I worked really hard to achieve. And so I introduced myself as Dr. Hasan, and kind of proceeded in talking with the patient about, the plan of care. But it's actually often the subtle things that people will say or do that remind you that sexism and racism and biases are very much still alive, and it's our job to kind of chip away at that one patient by one patient, or really actually even amongst our colleagues, we should all be working towards these biases on a daily basis.
Yeah. So, if you were to give one advice you have for someone looking to go in the same career path as you, what would it be?
Well, I think the first thing that I would do is find out what kind of medical programs are available, right? I understand that in the audience, we have some people who are younger in the high school ages, like in your freshman years, and some people who are seniors. So for the seniors, I would say, when you're talking about college and looking into college, don't just narrow yourself into the biologies, okay? Talk to people who you know, gain personal relationships with doctors or people who are in medical school to kind of understand what they would advise on a personal level for you as a degree or a major to take. so that it benefits you as a person as well as preparing you for medical school. And for those who are younger, like in freshman years, I would suggest looking into these short programs, right? So if you can get admission to medical school from high school, then that's a straight shot. I'm going to definitely recommend that. And that way you can kind of take advantage of the ability to focus on your education, and you won't have to worry about applying to medical school quite as much, because that's stressful as well.
Yeah. Yeah, okay, so another question came in and they asked, how did you find the motivation and never give up?
I did. I gave up a lot of times. But the reality is that you have to process failures. You have to process the difficult times and allow yourself time to do that, right? Because the reality is that no one is perfect. No one gets straight A's through like high school, college, medical school. I mean, there might be a few people here and there, but the majority are not going to, right? Like I struggled through medical school, that was hard. I struggled through high school, that was hard. I struggled through college, that was hard. You're gonna take some really hard classes, but there are two bits of advice that I can give you. One, acknowledge your own feelings. So if you're feeling down about something, acknowledge that it's there and then move on from it. I just did really badly on this test. That sucks. But I'm going to pick up, I'm going to move forward, and I'm going to do really much better on the next test, because this is what I'm going to change. This is what I'm going to do differently, right? The other piece of advice that I can give you about the hard times is surrounding yourself by people who are smarter than you and kind, right? So if you're the smartest person in the room, then you're not going to learn from your peers, right? But if you have smart people around you, you're going to constantly be learning, and you can learn from each other. And the reason I say kind is because increasingly, I think this world has the potential to become cutthroat, and competition, while it's important, is it has the ability to tear individuals down. And what you want to find is a group of people that will support each other in all succeeding, right? And so that way, it's not just like, okay, one person comes out on top and everybody else topples. It's we all walk hand in hand together through our graduations.
Yeah. Okay, so thank you for answering that question and all the questions that are coming in.
Yeah,
I have another question. Someone asked,
please.
did you go through residency years, and also how was the process of that?
Yeah. So after you do medical school, you have to apply to residency, which is different in number of years based on the field. So OB-GYN is a 4-year residency. Surgery is longer. Internal medicine is shorter. And then you can subspecialize and do a fellowship. So for me, after medical school, I applied into OB-GYN residency, and I did that in Chicago. So that was a 4-year residency. And then I applied into maternal fetal medicine fellowship, so I could train to be a high-risk pregnancy doctor. So that was another 3 years. Other specialties have different combinations of number of years. So for example, one of my best friends is an endocrinologist. His internal medicine residency was 3 years, but then his endocrinology fellowship was 3 years also. So it was a total of 6 years. Being a neurosurgeon, that's a really long trek. If I'm not mistaken, I think it takes like 7 years just for the residency. So 5 or 7 years. It's really long. So it's different for every specialty depending on the like how much you have, like what the scope of that field is.
Yeah. So I want to ask you if having a computer science degree, because I know some people here take mobile app developer or like programming classes, and they may want to become a doctor. So I was wondering if you know how a computer science degree will help you in being a doctor.
Sure. Well, so a computer science degree may not directly contribute to the application, but what I would say is this. I think a computer science degree is awesome because it demonstrates a person's own interests and expertise in something that is not medical, right? Now, what I would advise to a person who is interested in computer sciences is to talk to someone from a medical school or a guidance counselor in college and find out what the minimum requirements are to be able to apply to medical school, to make sure that you meet those requirements while you're in college. Because you can do a computer science degree and still have a lot of electives that you can take, like extra classes, right? And so taking the classes that set you up for an application for medical school, that's what I would advise.
Mhm. Okay, great. So someone else asked, is the MCAT test general science or based on the specialty?
That tests on general science. So there's a lot of, now it's my information is outdated, because remember I'm a dinosaur. I took the MCAT a long time ago, and it's very different now. But I know that they test for verbal skills. They test for physics, organic chemistry, I think was on there. So there's a lot of sciences, but I think there's actually even like social sciences type things on there now. So definitely, anybody who's interested in taking the MCAT, you can find information about that online quite easily, just to even get a general gist of the type of things that are on it. It is not based on specialties. So specialties, we have separate examinations, and the examinations are different depending on what field you go into. So for OB-GYN, there are actually for all medical schools, everybody has to take the STEP exams, which is, I don't know if you guys have heard of the term USMLE, where there's 3 steps to it: step 1, step 2, and step 3. And it starts in during medical school, you take step 1. During medical school, you also take step 2, and then step 3 you take after you've started your residency, no matter which residency it is. And then for your individual specialty, you have separate exams after you finish your residency.
Okay, so another question came in. Why did you decide to specialize in high risk under OBGYN?
I love that. So that's a very, very good question. When I was a second-year resident, so this is a 4-year program, and halfway through it, until halfway through, I thought that I was going to go into gynecologic oncology. So that's a specialty where people actually take care of female cancers through the surgical kind of aspect of it. And the reason I thought I wanted to do that is because I wanted to be a really high-powered, kind of fancy surgeon, right? But my moment of realization, my epiphany, was when I was a second-year resident, because my sister is a radiation oncologist. That means that she treats cancers using radiation. She and I were sitting in a morbidity and mortality meeting together. So morbidity and mortality meeting is where you talk about cases that were complicated and maybe something bad happened, so that you can learn about how to do things better. And we were sitting next to each other, and the first case that was presented was about either a maternal or a fetal complication. And I was sitting there on the edge of my seat, and my sister was crying. And when the next case, when they started discussing it, the next case was about a cancer patient, and I was crying, and my sister was on the edge of her seat. And so I realized that in order to excel at a field or at my career, it's not just being able to deal with the good days, because anybody can smile at an ultrasound. Like when you see a mom who's, seeing her baby for the first time, that's really special, right? But it's the hard days that are really going to make or break you. And I knew that I would not be able to take care of cancer patients without destroying myself. And I would be able to take care of complications with pregnant women, and that I would be able to cope with that. And so that was my aha, I've got to be an MFM.
Yeah, okay. So what extracurricular activities like clubs, sports team, etc. did you do in high school, and whether they helped you get into the program?
Yeah, that's a great question. So I mentioned that I did a lot of volunteering. I think we had a required number of hours, like at least 100 hours or something like that. That kind of activity demonstrates dedication towards serving, right? So that's an important one as a very, very baseline. I think beyond that, you've got to do something that's going to interest you. For me, I wanted to play tennis, so I played tennis. I'm not going to lie, I was not very good, but I stuck with it. I played tennis for 4 years during high school. And, you know, by the fourth year, when you're a senior in high school, in my school, you automatically moved up to what's it called? A team captain. And so I was team captain. And when you stick with something, it demonstrates that you are dedicated and that you are able to stick with something over a period of time like you would need to for college or high school. So it's not so much anything that I would advise that you do in particular, so much that you, more so that you should stick with it and do your best at it, like give it your all.
Yeah, of course.
Yeah.
So someone asked the top three qualities of a good doctor.
That's a very good question. So I think that has evolved for me over time. And I would say that the number one quality I would want in a doctor, even for myself, is adaptability, right? So medicine is changing. The face of medicine is changing by the hour. We are developing new strategies, new techniques. There are new viruses coming out all the time, right? And so being able to keep up with those things and not get fixed and be adaptable is a huge, huge, huge component of how to be a doctor nowadays, right? Like that might not have been true 2 decades ago. I think another quality that I think is super, super important is just simple old kindness, because in order to take good care of patients, you've got to have your heart in the right place. There are a lot of people who may not be in medicine for the right reasons, but that's when you find things like happening, like burnout, or people not being happy with their jobs. But you've got to love what you do. And if you've had a rough day and you can still say, I understand that my patient was late because she doesn't have a car and had to take 3 buses to get here, and you still see her, that's kindness. And I think that being kind as a quality of a physician is super, super, super important. 3 qualities. Okay, so adaptability, kindness, and the average one really is intelligence, right? So there's a lot of different kinds of intelligence. And so the intelligence that I was talking about was more like common sense, where, it's simple things. You can read books and memorize things all you want, but having common sense is actually really hard to teach. And so someone having common sense is a general kind of good thing to look out for. Emotional intelligence, common sense, that kind of thing.
Okay, so before asking another question, someone has a comment. Again, they really like your painting.
Thank you.
So another person had a question. They said, does GPA really affect the medical school admission? Like, what's preferred?
Sure. So that's actually a very good question. That's where doing some research about where you want to go to medical school and kind of joining those future doctor type forums is going to be really important, because the reality is you've got to have a minimum GPA, and then once you meet that criteria, everything else matters a little bit more, right? So if you all have, like, let's say 10 people are applying to medical school. If you all have the same GPA, it's going to be the rest of your application that sets you apart, right? So the GPA is basically there to meet a metric. I'm not sure what the minimum required GPA is nowadays, but that's going to be dependent on what medical school you're applying to as well, right? There are going to be some medical schools that are very strict, and there are going to be some medical schools that have a little bit more of a liberal requirement.
Yeah. So someone asked, did you have all A's in high school, like through your high school years?
No, I didn't. I didn't. I definitely did not. I tried to get all A's and I worked hard, but I did not graduate first in my class. And, I think the thing that we have to keep in mind is that, getting the perfect grades is not everything. It's important to do as best as you can and get good grades, right? But being at the top is kind of just that, right? Once you're valedictorian of your class, that's you check that check mark off and you move forward from it, and people aren't going to ask you again. The other things that you put your heart and soul into, that's going to matter. And when you meet people for an interview, that's going to matter. And how you write your essays for college, that's going to matter. So how you express yourself and how you conduct yourself, those things matter in real life more than the stuff on paper sometimes.
Yeah, exactly. Um, Another question, if you had to start all over, would you still become a doctor? And if not, what would you do? And what are some things that you wish you knew before getting started?
That's a great set of questions. Okay, so completely 100 totally percent honest, when I was a fellow in my training, there were times when I thought, if I knew how hard this was going to be, I may not have done the fellowship. Um, did I ever not want to be a doctor? No. I think that honestly, in the end, taking care of patients is really fulfilling for me. Even if I've had a rough day, I can think about a situation that brings a smile to my face or brings me fulfillment because I've taken care of a paid person or saved their life or something like that. Um, if I had to do this all over again, there is no doubt in my mind that I would 100% want to be exactly where I am again. I love my job. I'm very, very fortunate that I love my job. And it's hard. I mean, I work really long hours. I work hard. I dedicate myself to my patients, but it's really fulfilling.
Yeah, yeah. So someone else asked, do you have anything you want? Do you have anything else you want to accomplish in life? Any goals for the future?
Yeah, so that's actually, I appreciate that question because I mentioned it briefly before, but I do global health work. And so what I mean by that is that I practice in Malawi, which is a small country in Africa towards the southern aspect of Africa. And I work there 40% of the time. So the reason I'm here in Houston is because in this department, um, we have two high-risk pregnancy doctors who it's built into our job that we get to spend time in Africa and take care of patients there. And so my goal in life, honestly, would be to be able to continue that and practice in the US so I can keep on my skills, but scale up the high-risk pregnancy care and even general pregnancy care that people get throughout the world so that we don't have to say that the US is the best.
Yeah, of course. So I actually have a question that I wanted to ask you. Um, have you done global health work? And I wanted to bring this up too. So
Yeah, so I have. I actually, during my fellowship, worked in Ethiopia also. And during this past year in 2020, I was actually in Malawi for most of the time. So I was there from February until April. And I was supposed to, no, sorry, I was supposed to be there from February until April. But my partner, who was supposed to switch me out and come to Malawi, she actually wasn't allowed to leave the US because of our university restrictions. And so I stayed there until August. So by the time I ended up coming back to the US, I had actually lived in Malawi in Africa for longer than I lived in Texas. So it was really an incredible experience. I actually, because I was there during COVID, got to take part in a lot of COVID leadership and kind of pioneering, making sure that we managed COVID as best as possible in a very, very poor country.
yeah, of course. So someone asked that they know you previously mentioned that you want to be a doctor, and they said law and medicine are very different. And they asked, were you always good at biology or math? And she wanted to know that because the reason why you became a doctor.
Yeah, that's a really good question. So I actually fundamentally believe that no one's actually naturally good at very much. You become good at a thing by practice, right? Some people are good at memorizing and other people are good at understanding, and that I do believe in. So for example, people who are better at memorizing sometimes do better in biology, and people who are better at understanding do better at maths. And so I think that kind of describing it that way and understanding how your brain works and how you think will actually allow you to succeed in kind of all different aspects of studies, right? Because if you're applying to medical school, you have to take math classes like physics and calculus and all these things. You also have to take biology. If you're going to be a lawyer, you do have to take language courses, but other type of a variety of education type courses as well. So it's not just learning how to read and write, right? It's not just the basics. And so understanding your own learning style, I think, is more important than figuring out, well, am I good at biology or am I good at math? And that's kind of the advice that I would give to reframe, what am I good at? You're going to be good at anything that you practice at. If you spend time on something, you will become good at it.
Right. Okay. So someone asked, do the long hours affect your relationships with your family and friends? And do you have time for personal fun in universities, or was it always hard?
That's a great question. There were definitely some much harder times and some other times that were easier. Residency and fellowship are not easy. I was very fortunate that I lived with my family during my residency and my fellowship, so I got to be very close with them. I didn't have to travel on the weekends to go see them. Now I live far away from my family, but I'm still able to make time for my friends and my family, like on the weekends and the evenings. And I think that has a bit to do with being able to kind of prioritize your time and manage your time efficiently. So I think, yes, there are people who can get bogged down by it, but it's also manageable. And I think the culture of medicine is also changing over time. It has been changing so that we are trying to prioritize life-work balance. In terms of hobbies and things like that, I do make time for it. Right now I'm actually in the process of studying for another big exam. The exams don't end. There's a lot of them. But even with my studying for my exams, I love eating anything. And so that means that I love eating out, I love cooking. And so I make the time for that with my friends. So, the close friends that I can keep and my circle, especially during COVID. And so that's the kind of thing where finding the things that bring you joy and prioritizing your time can really help.
Right. So we're going to close up soon, like around 10 minutes. There's another interesting question. And they asked, have you ever thought of opening your own facility?
I'm going to ask for a little bit more clarification on that question. My own facility here in Houston or in Africa?
Okay, so while we get that situated, we'll move on to another question. But
sure.
Yeah, so is there lab hours required from high school?
Lab hours? No, not from my recollection. Now, that might have changed over time and maybe it's different, but I did not have any lab hour type requirements when I was applying, and I can't imagine, because the opportunities that are available for everybody are not the same. If you have it, that's great, and I think that it demonstrates initiative, but I think for me, for example, if I was looking at someone applying to medical school, I would value lab hours just as much as volunteering time in a medical office.
Right. Okay, so the facility question, they said over here.
In Houston. No, and I'll tell you the reason why is because I work for Texas Children's in Baylor. So it's Baylor University, Texas Children's Hospital. Being a part of the hospital system and being part of a university allows me a lot of privilege that I have that's different from private practice. So being able to spend 40% of my year in Africa, that's pretty unique. I see a huge variety of much sicker patients here than I would in a general private practice. Like if I had my own clinic, like I see some really crazy stories, and that's really cool because it keeps me on my toes, and it also kind of it promotes this idea that we are all always learning. Like even my senior faculty, like I work with some really famous people in the field of medicine, or in the field of MFM, and everybody's always learning. And I think to be in that kind of culture is really something that I value highly.
Yeah, okay, so a follow-up question to that, what about opening up a facility in Africa?
So that is something that is a long-term goal of mine. And I actually do think that I might want to, so my ethnic background is Pakistani. And so my life goal is eventually to be able to open up a clinic or something like that. In the same way that we've done in Africa, somewhere in Pakistan, where I actually speak Urdu, the language that's spoken in Pakistan, just to be able to identify with patients and help people that kind of, well, for lack of a better description, look like me. I think that we all, one of the things that we have in medicine, in academic medicine, is called grand rounds, and that's where people are invited to speak, just kind of like this too. And the speaker today was talking about diversity and how it's important to see people who look like you doing the things that you want to do. So if you are, I think if I'm not mistaken, a lot of you guys, if not everybody, is Turkish in background. Seeing people who are Turkish in the field that you want to end up in actually helps promote you getting there, because it builds this subconscious reality for you that it's possible. And so in the same way, I would want to do that for women in Pakistan.
Right. Okay, so what advice would you give high schoolers?
About what?
I guess any advice?
I can give advice about life.
I'm sure we would want to hear that. I would want to hear that.
Advice about life is enjoying every moment. I think that one thing that I did during high school and college and medical school was just kind of looking forward to the next step, and just, saying, I can't wait until the next step is over. I can't wait until, high school is over. I can't wait until college is over so that I can't wait till I'm a doctor so I have money. And the reality is that if you don't enjoy every step as you're going, you're going to miss it. Right. And I did learn this along the way. But you've got to work hard, and it's going to be difficult. But when you're taking a break from reading your book, look up and look around, enjoy the sun, exercise, enjoy the green, and enjoy life as it's happening, as well as working towards achieving your goals.
Yeah, I think that's really important too. So we'll take a couple more questions. Someone asked, is medical field worth it financially?
So that's a very complicated question to ask, because getting a medical education is very expensive. And so, getting loans, for example, to get through medical school, that can add up. And it's becoming, if I'm not mistaken, and I don't want you guys to feel like, we're brushing over things, but it's better to go in with your eyes wide open. Depending on what medical school or college you go to, you can end up owing like $400,000 by the end of it, of medical school debt. And sometimes, depending on what field you go into, that's going to take a really, really long time to pay back. Now, sometimes you don't have to take loans, and your parents are able to help you, or you're able to work in the meantime, and maybe not all that debt is a problem. But taking that into account, while doctors can make a lot of money, we spend half of our lives paying back our loans for our education. So if you're in medicine for the money, then please do not do medicine. It's not worth it. You've got to be in it for your heart, for the patients, for your career, so that you love what you do. If you want to make money, medicine is not the way to go. There are a lot of other ways to make much more money without working nearly as much.
Right, right.
Or as hard.
Yeah, exactly. So this is the last question that I think we're going to have time to answer. What kinds of problems did you have in this field due to your ethnicity or religion?
Actually, very fortunately, none. I'm Muslim and I'm Pakistani in background. I told you that already. I've been very fortunate that, simple things like praying. I like during my fellowship, for example, I had a fellow's office where we we shared an office amongst like 6 people, and I brought my prayer mat in and I set it on the ground and I would pray as I wanted to. No one ever questioned it. People respected me for it. Um, in Chicago, and this is going to sound a little silly, but I was also there through the polar vortex. And so people, when that winter was very cold, I was wearing my scarf like a hijab all the time. And so people thought that I was Muslim, or that, that I started wearing hijab permanently. I explained that I had not made that choice yet, but people were very actually encouraging about it, and really kind of supported me. And if I was going to start wearing hijab, here in Houston, I get the same thing as well, where people are inquisitive and support me in like my religion, my culture. And again, it's really nice to be able to see people who look like you. And I'm very fortunate to work in a division, like the maternal fetal medicine doctors that I work with. We're very, very diverse. I work with a lot of Indian women, Hispanic women, um, uh, work with men, white, brown, black, kind of all colors. And so seeing a variety of people that you work around also fosters that sense of support and acceptance.
Mhm. Right. So I was wondering if you have time for one more question. Someone really wanted. Okay. So someone asked, since you work in Africa, how common is sickle cell anemia in Africa, and how effective is gene therapy there, the treatment there?
That's a great question. So in Malawi, I actually didn't see very many sickle cell patients. I actually see people more with sickle cell disease here in Houston than I did in Africa. What we see more often there is HIV, more prevalently as kind of a population issue, which is interesting because that's where we learn. I'm sure maybe some of that reference was coming from, like, we know that people who are sickle cell carriers are resistant to malaria. And so there's a kind of what's an evolutionary benefit for African people who can be exposed to malaria. Um, Now, in terms of gene therapy, I'm actually not aware of that. And that might be different depending on what country you go to as well. So Africa is a really, really huge continent, right? And has many countries. And the reason I mention that is because the countries are also very varied in how much technology and advancement they have. So, for example, South Africa is very advanced in comparison to very poor countries like Malawi. And so gene therapy is not even on the, the on the radar for people in Malawi, but it may actually be for in South Africa. And I'm not sure of that, but I can look into that.
Right. Okay, so I think that's all of the questions. Thank you for your lovely answers. It was really mind-opening, and a lot of people enjoyed this talk. Yeah,
Thank you very much for inviting me, Nadine.
of course. So I want to thank everyone for joining tonight's career talk, and especially Dr. Hasan for taking the time out of her busy day to talk to us. We'll continue to invite more guests to guide us with our journey, so don't forget to join us next time. And have a great day, everyone.
Thank you very much. And if anybody wants to, you're welcome to contact me by my email, Nadine. You can go ahead and share that with anybody who is interested.
I'll put it in the chat, guys.
Perfect. Take care. Thank you.
Thank you.